overdosed countless times. My life continued to spiral out. At the time when I was looking for treatment, there was only two treatment centers that served people who had heroin addiction. The staff didn't look like me, and so I came back to Minneapolis, and I wanted to continue my recovery journey, and I did that through a MAT outpatient programming, where this program had people that looked like me, people who had lived experience, and I was able to connect.
Hello, everyone. Thank you for tuning in to Stories from the Field, a series of podcasts that dive into the issue of the evolving opioid epidemic in Minnesota. Our goal? Simple: to give voice to those who are or have experienced substance use disorder and to provide perspective into the issue. I'm Julie Barkey, and welcome to Stories from the Field. We are joined by three Minnesotans who have unique insight on opioid use and how it impacts many Minnesotans of color. Pearl Evans is a woman in recovery, and she's using her experiences to now help others. Clarence Jones is the community health strategist for the Human Partnership. His role is to hear the community's public health concerns, find allies to collaborate with, and to address these issues. And finally, Yusuf Shafi. He's an active and very well-respected member of the addiction community in Minnesota. And in 2015, he opened the Alliance Wellness Center, which is a substance abuse outpatient and inpatient treatment program. All of you, thank you so much for joining today. And I'd like to begin this podcast with Pearl. She has a very unique experience with opioid use, and it's one that many might be able to relate to. So Pearl, do you mind, with all of your insight and experiences, can you just maybe share what you went through and where you are today?
Sure, Julie. Thank you for having me. My name is Willie Pearl Evans, and I am a person living in long-term recovery. I am recovering from heroin addiction. And I started using heroin at the age of 34 years old after some traumatic experiences. I am a survivor of sexual abuse as a child and as an adult. And I experienced some other traumas in my adulthood. And as I navigated the world with these traumas, I became emotionally distressed. I lost two family members, my sister and my aunt, who were some important figures in my life. And so not having the tools to deal with this grief, along with the other traumas that I had experienced as a child, I spiraled out of control. I started using heroin at the age of 34. And throughout my heroin addiction, I experienced a lot of difficulties with parenting, being able to go to my son's school and have a conversation at parent-teacher conferences. That was a problem for me. And my son was a stellar student, so he did not deserve this. So it was incidents like this where I was unable to communicate and be an effective parent that troubled me. And then also I overdosed countless times. After overdosing many times, without receiving any support on how to move forward and how to deal with my addiction, I continued to spiral. My life continued to spiral out. And so I had one incident that happened. My oldest son, I found I learned that he was using substance. And so that was a major concern to me, the intergenerational substance use. And so a combination of all three of these events, the childhood traumas, the ineffective parenting, and knowing that my son had started using, these were the things that moved me towards recovery. And so once I started searching for recovery and how to build my life back, I experienced some significant barriers at treatment centers. At the time when I was looking for treatment, there was only two treatment centers that served people who had heroin addiction, and that was Wilmer and one in St. Paul. And so I went to the one in Wilmer. I was disconnected from my community. I was unable to parent for my kids. The staff didn't look like me, so I felt overwhelmed and I didn't feel supported. And so I came back to Minneapolis, and I wanted to continue my recovery journey, and I did that through a MAT outpatient programming where there was where this program had people that looked like me, people who had lived experience, and I was able to connect with that culturally specific programming. And that is how I began my recovery journey. And from that point on, I began to show up in recovery spaces to share my story. And from that, I ended up doing some legislative advocacy work. I ended up sitting on an advisory council, and a combination of that work and my dedication to wanting to return to the community and help others and elevate the Black recovery narrative, that is what led me to my work at Minnesota Department of Health.
Oh, Pearl, what a story. Clarence, let's start with you and a little bit about your work in the Black community specifically. But when you listen to Pearl's story, is it unique, or do you find that this is something that is really common? And if so, what are you hearing from your communities and what are you trying to do about it?
Well, first of all, let me thank you, Julie, for the opportunity to be here. And I am excited that I had a chance to meet Pearl. Now, one of the first things I tell people is this: I'm a community health strategist, and I was approached by one of our members, Dale Gates, who told me that opioids was a problem in our community. And I said, okay, I don't do opioids, so I don't know. I went to a colleague. I was a director at a federally qualified health center. I went to one of my colleagues and I said, well, as human, we're going to be working around opioids. And she says, why? Your people don't do opioids. I said, okay, I don't do opioids. I don't know. But when I got out into the community, what I found out was that we are doing opioids. We just don't call them opioids. And immediately when that happened, it struck something inside of me because I thought about the fact that so here we are with an emerging issue or a issue that's there, and we're going to play name games. We're going to use language. I thought about crack and cocaine. I thought about how unfortunate it was for our community because it was criminalized for us. And it was a medical epidemic for other people. And so we started doing community lunch and learns. We started meeting with government officials, HMOs. We started with the community to try to figure out what it is that we should do. And so our position at Human is to listen to the community, to find out what the community is saying, and to find allies that can help us to work together in order to address this issue. But we believe very much in the fact that it has to be community driven as to be community led. And so that's what we have found. We recently, you asked me about people like Pearl specifically. One of the things that is so important for us is that we believe that people have to have their own narrative. Community have to have their own narrative. And so I can't go out and say, well, I think the community is like this. I don't do it. I don't know. And so we actually, with the city of Minneapolis, as well as with the University of Minnesota, we created a couple of surveys where we actually went out into the community and asked them questions. The first survey was really about how do you identify opioids? What do you call them? And we found out that in our community, we don't call them opioids. We call it heroin. We call it oxycodone. I mean, it was like 15 or 16 other names. That's it. So first of all, we have to make it clear that when people are saying opioids or they're saying this, that we are on the same page. After that, we had a grant from the city of Minneapolis to do like 400 surveys in North Minneapolis. They gave us 3 months to do them. We actually wound up doing over 500 in less than a month, asking people questions about, first of all, we asked them from an asset, a strength-based perspective about your community, about your life. And then we got into the opioids, because one of the things that we were very mindful of, Julie, is that we did not want to come in and try to assume that we knew what was going on. We wanted to find out, how did people identify their own strengths, their own health, and then we could give the community the information so that they could have a narrative so that they can begin to address the issue. So what did we find? We found out after about these 500 surveys where we compared not only Minneapolis, St. Paul to the rest of the world, that we have an issue here, and we have a variety of different things that we need to address in order to help people with opioids. We just can't say, well, we're just going to address opioids. There's some underlying factors that are here. And so part of what we are trying to do is to identify them using data and community language and community narrative in order to address this issue. And so we're very fortunate that we have been able to work with the community and will continue to work with the community around this issue. There's much more to say, but I just want to leave that as a start.
And I appreciate that because I'd like to give Yusuf a chance to kind of explain to us, if you wouldn't mind, Yusuf, the community specifically that you work with and some of the unique challenges that you have to engage in to try to get some connection on this issue.
Hi, Julie. Thank you so much for having me. I'm honored to be here this morning with you guys. I am Yusuf Shafi. I predominantly work with the East African community. In the last, Alliance has been around for about 6 years or so. In the past 3 years, we have seen a lot of young men and young women that are struggling with opioid addiction. In fact, our referrals have changed. We see a lot more young people more than ever. And so there's a lot of stigma associated with using alcohol and drugs in general in our community. In fact, if you're using opioids, there's even more stigma. And so one of the things that we try to do is really important for us to educate people, what opiates are. This is an issue that's new to us, as a lot of everybody talked about. So this is something that is new to us, and a lot of our community members are struggling. A lot of young men are struggling, and the sad thing is a lot of the parents don't understand what opioid addiction is. So part of my job is to make sure that we educate people and meet them where they're at. People don't know what, services are available to them. A lot of them sometimes might not understand the process of getting to treatment, something that's new to us.
I was just going to say, we talk so much about treatment and what happens once somebody has a problem, or we know of somebody who has a problem. We heard about Pearl and we heard about her struggles. And Pearl, you're part of a lovely collective community too. What do you guys find? I mean, for those of us who can't really identify, what are some of these traumas? How do you get upstream from this? Why are people using? Is it typically trauma or is it recreation? I'd love for you to paint this picture.
So this is Clarence Jones. Part of what we found in terms of our survey is that there are a variety of reasons, especially now with COVID-19, that has really increased the use of opioids. The isolation, the lack of sleep, just relationships, domestic abuse, all of these things have really piled on top of the circumstances within people's lives, and has really caused them to look for external things in order to bring some kind of clarity to their life.
And for me, I would say many of the issues that I believe that people struggle with when they have substance use is the lack of programming that is responsive to their needs. For example, if I was a parent, I had 2 children, and at the time there was not a program to support my kids who had been traumatized from my substance use. And without that lack of support, my oldest son, he became addicted to substance use. So I think one of the issues that we need to start looking at is addressing this and looking at the whole person, as a parent, someone with children, helping the parent get treatment, that's a step in the right direction. But helping that whole family, how can we support that family? Because in my substance use, my kids were traumatized from the overdoses. They were traumatized from the whole process.
I think speaking for the East African community, and what I've seen in my work is a lot of the young folks that we see have some sort of a undiagnosed mental health problem, or a lot of them struggle with identity crisis. So a lot of them try to fit in, and maybe they're from the environment where people around them are using alcohol or drugs. And so they might try it, and then next thing you know, they might be, using it more often than they thought they would. And so I think that's what I'm seeing. And to be honest, a lot of them are numbing the pain. A lot of these young men, young women are in pain, and they're struggling with the COVID. It's been a lot more challenging for people to get out, in general, we're a community of, going out and talking and hanging out. So, being cooped up in the house or being, isolating, and so those things are not easy for us. So that's why we've seen a lot of more young people, struggling with addiction, specifically opioids.
And so how specifically do you try to close these gaps, bridge these gaps, make a connection and get somebody the help that they need?
Well, that was one of the reasons. This is Clarence again. That was one of the reasons why we did the survey. Is that, and I want to agree wholeheartedly with Pearl. Is that what we found out was that people would the least things that people were interested in was like more information about it, but they were more interested in the community. From our survey, just from this limited survey, they were interested in finding out where the programs were in the community that could help them to address these issues. And so part of how do we get there? Well, by making the community more aware of what they have self-identified as important for them, but also giving them the data and giving them the narrative in order to be able to go and to approach MDH or to approach the state or to approach the city to say these are some of the programs that we need.
I think for us, we just try to meet everybody where they're at. I mean, we're blessed to have Alliance Wellness Center, which helps people from that community, and they have a safe space to come in and seek the help that they need. But I think it's really important for us to meet everybody where they're at and to also educate. Education is so important for our community, for people of color. Trust, it took a while for us to build a trust. So I think it's important for us to meet everybody where they're at and just to do a basic education. People don't even know about Narcan. Like it took us, a while to get Narcan to people and make sure they have one at home with, make sure they have one in their car. I mean, as simple as that, as basic as that. So we have to sort of meet everybody where they're at and to also educate them. I think that's very, very important.
And for the sake of our listeners, Narcan is a brand name of naloxone, which is a drug that reverses an overdose, and it's given typically in an injection, and we'll have a lot more information on our MDH website on that as well. But Pearl, I wanted to get to you particularly because you do have lived experience in this area. And do you find that you work almost like an ad hoc counselor for other people as well? Do they come to you and ask you how you were able to pull yourself out of this?
Yes, indeed. That is a question that I often get. And so I just share my story, and I also share what worked for me. And I also, encourage them to look deep inside and say, search for services that will meet you where you are. Like the harm reduction services, I think was so important for me because I didn't know what Narcan was at the beginning of my continuously spiraling and overdose experiences. And then finally, I was able to get Narcan. That's one thing. And then another thing that Clarence mentioned that I want to echo off of is that, this is a community issue. And when we talk about my individual and lived experience, there are many other lived experiences out there that we often don't hear. And that is the way that I think we can address this is when we continue to make spaces like this one, this podcast, to invite other individuals to share their experience. Because when we hear the lived experiences again and again, and we hear different lived experiences, that is also a pathway to someone else's recovery to say, hey, I know that person. She lived in my apartment. I went to high school with her. So recovery is about social connection. So hearing someone else on these podcasts, that'll help someone who is struggling right now today with substance use to make that connection and say, I'll reach out to them. I'll get in touch with them. So hearing these stories and hearing it from a lived experience, especially from Black Minnesotans, we are left out of this conversation because often it's saying opioids. Just educate more on heroin addiction and just knowing that heroin addiction is real and that it is a treatable medical condition. And so just bringing in other folks who have lived experience and making those social connections, because that's how the recovery process starts. Recovery is a social network. It's building on what has worked for you, what has worked for someone else, and just sharing those stories and hearing those stories. That is an excellent path to building your own recovery story.
So I think we just saw an example of why we need to be really community specific around this issue, and that we need to be asking people in their communities what's going on. You have talked about the fact that there needs to be a lot of education and information in his community around this particular issue, and I understand that. When we talked in the Hawthorne neighborhood, they were talking about the whole issue around. They wanted to have more community specific information about what resources are available, and I think that's the challenge that we're going to have to undertake, because people get to this whole issue around opioid addiction or substance abuse addiction through different ways, and so we have to, as advocates, we have to be able to listen to the stories and give people what they need in order for them to make the decision, to make an informed decision about how they're going to address this. And it has to be community driven. So that was the point I wanted to make. So I agree with everybody.
I would like to ask each of you real quickly, just to summarize this as we're about done, because I hear such passion and I hear such energy from all three of you. Here's your opportunity to speak to Black Minnesotans. What do you want them to take away from this podcast and this issue? Clarence, let's begin with you.
I think the thing that I want them to really take away from this podcast is the fact that we have people in our community that really do care about you, that we want to know what are the issues that are causing you to be substance abusers, and that we are working very hard with other allies to try to find ways to address this, that you don't have to fight this thing by yourself, and that it's important for you to know that we do care. That's as simple as I can make it.
And Yusuf, what would you like people to take away from this podcast?
I think I wanted to say that, there's help available, there's treatment available. We are blessed to have programs that are culturally specific that can, meet you where you're at. I think that's very important for people to understand. And I think this is a treatable disease. It's like any other disease, it is treatable, and there's services that are available that are tailored to specifically you. So just make sure you try to get as much resources as possible. Make sure you try to get help, and we're here for you, and we're here to help you out.
And Pearl, you have this lived experience. What do you want people to take away?
I would conclude with recovery is possible. If you're in substance use right now today, just knowing that there is a community of people that are willing to support you, reaching out, making those connections is the first step. Recovery is possible.
Yeah, recovery is possible, and these deaths are preventable. And we, of course, at the Minnesota Department of Health will have resources and more information on our website. And we can also help connect you to Yusuf, Clarence, and Pearl. How can I thank the three of you for your time and your perspectives and your passion? Thank you again so much for coming onto this podcast today. We hope everybody takes away just a little more information and a sense of optimism that they can get help. With Stories from the Field, I'm Julie Bartke with the Minnesota Department of Health. Thank you for listening. We'll see you next time.